So, hi everybody, welcome back to another specialty spotlight. Today I'm so excited to have someone who I met at RSNA a couple of years ago, Dr. Shuri Wang. She was a Fast Five. I remember that was like the first time that I even like saw you in your outfit. I was like, oh my God, it looks awesome.
Thank you.
So Dr. Wang, you're a body imager, is that right? And you're,
Abdominal imager.
okay, sorry, abdominal imager.
Some people like to make that distinction.
Okay. Yes, we will make that distinction. Okay, so abdominal imaging, and you're at the University of Utah. So, how did you find body imaging and radiology? And like, tell me about your journey. Sorry, abdominal imaging.
I want to first say I'm a big fan of yours, Yasha. I love what you've done with the YouTube channels. I like how you've engaged with the next generation of radiology residents. And I think that is so important to pass down the baton. In terms of my own journey, I was trained in Australia, so I am an IMG. I only
Okay.
came to the US in 2017, so I'm relatively new. I chose abdominal imaging for a few reasons. Firstly, I'm a very pragmatic person. So at that time when I was deciding what I wanted to do in fellowship, I knew I wanted to come to the US.
Okay.
But I really enjoyed breast imaging as well as abdominal imaging. But the problem is in Australia, the setup is most people are generalists, like general radiologists.
Okay.
So if I did do a fellowship in breast, I felt that it couldn't transfer as easily into a general practice kind of setting for radiology, especially in the private sector, which most of us eventually go into back in Australia. And at that time, when I was graduating, Australia started having Medicare rebates for abdominal MRIs. So that became like quite a hot market, and private groups wanted people to read these. So, being pragmatic, I decided that's something I want to do. And I think it was a blessing in disguise because I really enjoy it. I enjoyed the breadth and depth of what abdominal imaging can offer. There's so many organs you can pick from. So it always keeps things very interesting. And that's what I really love about my specialty. The other thing that I like about it is we still do a lot of procedures. So you do get that patient contact, and you also get some more practical skills, which I personally also really, really love.
Yeah, I mean, that's also something similar to kind of breast imaging. And I know a lot of people don't realize that as an abdominal imager, you do get to do a lot of procedures. What types of things do you get to do?
So mainly biopsies and FNAs, both ultrasound guided and CT guided. I did also play with the thought of maybe IR when I was thinking of what I want to go in later. But I think IR is just, I have the greatest respect for the interventionalists because I think their life is pretty hectic. They're
Oh, yeah.
basically very surgical lifestyle. And for me, I think that would have been tough. Things that I want to do in my life and what I put as priorities. Yeah.
I completely agree. I know that when you're an interventionalist, you're kind of on call all the time. So it is kind of a tough life, but I think it's very gratifying. In terms of like, how did you always know you wanted to do radiology, or was that something, I don't know in Australia if it's kind of like more hidden like it is here, or if it's more exposed. Like, tell me a little bit about that.
It's hidden as well, just like here. And you have to kind of specify you want a rotation in radiology as a medical student. And they don't seem to be as popular because there's only a finite amount you can do as a medical student in radiology. A lot of times you're really watching people reporting or just some sporadic teaching.
Hmm.
The reason why I went into radiology, so when I was a medical student, I wanted to do psychiatry.
Okay.
Yeah, which is completely 100%, like 180 degrees different from radiology, right?
Yes.
Then I did my rotation in psychiatry, and I felt, wow, I don't know if I could do this because the burnout rate is so high. And
Hmm.
I'm someone who find it very difficult to detach from my own emotions. And for me, I feel like that's probably not something I can do for a very, very long time.
Sure.
So at that time, my sister, she's 5 years older than me, she was already a radiology resident. And
Okay.
she kind of, yeah, so she kind of pulled me into the radiology realm. And I saw how, firstly, how happy she was
Mm-hmm.
compared to when she was an intern. And she really loved what she was doing. She basically just tells me, this is very fulfilling. This is very emotional, like intellectually stimulating, and it was a lot of fun. So, because based on how happy she was and everything, I kind of decided I want to see what radiology was about, and that's why I chose a rotation during my medical student years. And I agree. I think this is the best specialty. I know
Mm-hmm.
I'm slightly biased. And subsequently, the year after, my brother also joined us
Oh my
as a radiologist.
gosh. Family
Yeah.
affair. That's awesome. And I'm sure it's like nice to have those conversations with your family. You're like, oh, I had a cool
Yes.
case the other day.
Yes. Funny you say that because my brother doesn't really like texting very much and he's kind of introverted, but he would text me like a abdominal x-ray and he'll be like, what is this? And it was like gallstone ileus. And it's
Oh
like,
my
this is
God.
how we text each other. It's kind of lame, but it's also
No,
very
it's not.
interesting.
Yeah, it's really cool. It's really great. And that's something that I really hope we can change because in terms of like, I feel like people that go into radiology, they either already know somebody in radiology or they have like a mentor, but not everyone gets that chance. And we're not all lucky enough to have family members that are radiologists already. So that's part of the reason why I do this. And
Yeah, yeah, that's why I think your YouTube channel, that's like the value of it. You're actually spreading the word to so many people
yeah,
that would otherwise not have that.
that's literally the whole reason. I hope I can like connect to even a couple people. But can we also talk about the fact that you were in IMG? Can I just like ask you what that journey was like and what was helpful for you in kind of getting your foot in and actually being successful?
So I have to everything I say is credited to my sister. I think she is the most amazing role model, and she came to the US first. Her journey is a little bit more difficult compared to mine. That was when the Great Recession happened, and it was very difficult to find jobs. My journey, I think I'm very, very lucky that it was relatively easy. To be 100% honest, I did not see myself as staying in the US. I signed up for 1 year fellowship because my idea was, I don't know what the US is like. My husband has never lived in any other country other than Australia. So for him, he was like, I don't know what's like. I don't really want to put all our eggs in one basket, which
Mhm.
was completely fair enough. And then after that 1 year experience for fellowship at University of Washington in Seattle, I realized how much I enjoyed academia. And I know it may sound very weird to a lot of people who've had experience with academia, but I think what you want to make of it is up to you. And that is kind of like the beauty of academia or even private practice in the US.
Mhm.
So for me, my goal, if I was going back to Australia, was just to be a 9 to 5 private practice radiologist. There's nothing wrong with that. But I found so many interesting things. So, such as like writing papers. I know people probably will want to spew, but writing papers really got me going. I was like, wow, you can really disseminate really good information by publishing. And what better platform is that? And to do that, so that really hooked me onto, let's try and stay in the US. And the year after, I was lucky enough to find a job at the University of Utah, which I'm really, really grateful
That's
and thankful
awesome.
for. So my journey has been relatively easy compared to most IMGs, and I am very grateful for that.
That's really great. We definitely need more IMGs and more like diversity within radiology. So I'm excited that you are able to find a position and actually like thrive in academics here in the US because that's really what it's all about and finding things you're passionate about. So really, really good for you. You talked about academics, but what is a day in your life in academics like? Like, how much do you read? What types of studies do you read? Things like that.
I am a more proactive attending because I don't really like the resident to feel like they're drowning, because I feel like that takes away from their whole experience. And, we should all chip in when, the list is crazy. That's my own personal belief. So I do quite a lot of primary reading myself, as well as reading out the residents. I like when the residents can ask me questions straight away, because then it's kind of cemented in their mind. I had this problem, this is how we solved it, and hopefully they'll learn from that experience. So my interaction is mostly with the radiology residents, as well as referring clinicians through like phone calls, even like Skype. We had some Skype consultations with different
Oh.
referrers, which was really nice. So those are the people, and obviously my colleagues, my other attendings, and my fellows. Um, on top of that, you'll have a lot of interaction with the techs. Ultrasound, a lot. In particular, they'll come and check things with you, or ask you whether you want to take any more, what other images you'd like, etc. And CT techs, and our reading room assistant. And actually so the reading room assistants and all the techs, they're actually very, very helpful. And I make a big effort to have a good relationship with them, because they can make your life much easier. So it's worthwhile investing in that kind of those relationships with them as well. Patients we interact with through procedures. We don't do that as often, but on the days when we're ultrasound, yes, we do interact with the patients quite a lot.
Hmm. Yeah, that sounds like kind of how we are set up too. The ultrasound techs are always coming and showing us things, and it's nice because then, like, if they're worried about something, usually they're pretty much on the money. So you're like, okay, let me take a look at that right now because there's probably something going on. So, no, that's really excellent. And I know that you're a huge like women's advocate, gender equity advocate. How did you find that? And what advice do you have for like women that are considering radiology as a specialty?
So I think I found that by moving to the US, it's actually very interesting how this whole thing evolved, because for me, I never ever thought about that. Back in Australia, females were the majority in medical school, 60% female.
Okay.
And in radiology, it's also mainly females.
Interesting.
Yeah, so it was very interesting to me when I came to the US that people were like, I don't know why in radiology we can't attract females. And I was like, oh, most females feel like radiology is a very female friendly, it's very family friendly, and it's also very family planning friendly specialty. And through COVID, I actually realized that we are very unique. Say, for example, teleradiology.
Hmm.
Teleradiology is something that makes your work and your lifestyle fit together. And I think that is the flexible work that a lot of females are looking for. I know with training, it's not as flexible, but if you think about it, training is only 4 years of your life. So, in the big scheme of things, you have a lot of opportunities after you overcome that training stage.
Hmm.
Um, so that was like the first thing that I thought about. I was like, why is it different? And the second thing was I was pregnant um, during my fellowship. I had a wonderful experience. My fellowship was amazing. I did not have a very easy pregnancy, and they catered towards my needs. So in that sense, it was really, really good. But then I had girlfriends who were pregnant around the same time as me, and I see all their updates on Facebook. One was in the UK and one was back in Australia. And they were like, oh, yeah, I'm off on maternity leave. And I was like, how many weeks pregnant are you? And it seems like they were taking maternity leave when they're like 32 weeks pregnant.
Wow.
And I was like, well, I was told that you basically work until you pop. And I'm thinking,
Exactly.
hang on, there's something not right here. So then it got me thinking and discussing with my husband. And this is why I'm a huge proponent of, parental leave and giving people time to go and be a mom, be a dad, look after their kid and enjoy that bonding time. And then the other question that came up was, hey, how come we don't have a pump room? Then I was thinking back, I was like, back in Australia, we never had pump rooms. Why was that? And then my husband was like, well, because everyone takes at least 1 year off after they have a baby. And I was like, yes. So there was no need for a pump room because you're
Interesting.
not pumping while you're working. You've your kid has been breastfed for a year now. So then, yeah, all these experiences got me questioning and wondering, like, what can we do better? I do believe that parental leave is something that is very, very necessary, and we need to normalize that because people wanting to have kids, that's normal, and you shouldn't be penalized for it. So that's kind of my long-winded journey of how I reached here. Then after I had kids, my journey again shifted. People were like, for my fast five, the reason why I came up with that was someone asked me, like, what do you do with your kid? Like, you take your kid to every single conference. And for me, I was like, yeah, my husband just stays with my child and looks after him. Like, and I go and do whatever I need to do. And this made me think, how many young, not just like young residents, fellows, and young attendings or any attending at any age having a kid, like, what do? They just miss out on all these opportunities, which actually makes a huge difference and huge impact on their career. And this is
Yeah.
something that is actionable that we can do. So that's basically my journey of where I am now. And I'm sure it'll morph as my child gets older, as I become more empathetic towards what people are experiencing.
No, that's really interesting. I mean, I actually think that there are, I mean, things during residency like AIRP, for example. I mean, I can't imagine if you just had a kid or even any age child that you're going to leave for 4 weeks. That sounds like that's a really long time. So in a way, I do believe that like COVID was able to help us implement more of these like virtual, like teleradiology became more normal, like everything was kind of you're able to have a better balance because of a lot of things that came out of it. So I totally I'm with you. We definitely need to do better. And I just read that like New Zealand passed the law that if you have a miscarriage, I don't know how much time, but you get time. And I think all of those things are really important. And I'm really glad that there are people like you that are able to speak up for, all of us women. So thank you.
Well, it's my pleasure. And I actually, when I started on this journey, I wasn't sure how much traction I would get. And for me, in medicine, it's kind of scary to be the one who is saying something different, right? It's very scary to dissent and give an alternative perspective. Um, I did that because, firstly, perhaps it's because of my ignorance. I didn't quite understand what a taboo this topic may be, and then so I just went out there and did my thing. Um, and then coming back to like women and children and support that we give to our female physicians, why we need to do that, it's also that it's better for their marriages, because I can't imagine going to ARP for 4 weeks and leaving my husband with my kid. I mean, that is a huge strain on your partner, your
Mhm.
spouse, and on your marriage. So I think we need to support the physician, and that in turn will support the family unit.
I completely agree. I think that hopefully, as I kind of enter more like less residency stuff and more attending stuff in the coming years, hopefully I can do more work in that realm too. I think that we're starting to gain momentum. So things are starting to change, which is nice. It's definitely much needed. And yeah, it's kind of crazy how long things kind of remain the same until someone kind of speaks up because I mean, pump rooms, lactation rooms, as I'm just like thinking about everything. So
Yeah.
yeah, lots of work to be done. Okay, any last minute advice for like med students and specifically like women med students even considering radiology?
Yeah, my advice for anyone really is to you need to first figure out what your core values are. And being a great radiologist is one thing that you have to master because that is your job and it's to do with patient care. But you should also find things outside of that because, you know, we are physicians, but that is what we do. That is not who we are as a person. And it's really important to seek those avenues. In a way, it becomes more sustainable as well as you are helping your community in whatever way you choose to. It could be very creative ways. So that would be my advice to people. And my last advice is don't be scared to be weird because, or unconventional, because
Yes.
my sister, so I was always called the weird child, and my sibling would call me, you know, what's up, weirdo? But that's completely fine because that's gotten me to where I am in, you know, this stage in life. And my sister sent me a picture that said, "You're not weird, you're just limited edition." So I think that's really important because who doesn't want a limited edition bag, watch, or car, right?
I know,
So
that's true.
that's my advice.
No, that's great advice. I completely agree with all of it. I mean, I think I'm living that right now too. Just like do your own thing and you'll be successful. Well, thank you so much. I really appreciate that you took the time and told me all about women and everything, academics. This was so enlightening, even for me. And I've heard you speak before, so this was like super fun. And I will have Dr. Wang's information listed down below. She has an awesome Twitter page, and also she started making YouTube videos too, all about like, I've only watched a couple of them, but they're very educational, and I think
Thank
everyone
you.
should check them out.
Thank you so much for having me. And I hope to see everybody in real life in some conference or another in the coming year. Hopefully, fingers crossed.
Yes, fingers crossed.